There's still one less than the VA's on.
All set, are we done?
Yes.
Okay, I'll call personnel to order. Need a motion to accept the minutes of July 10th by Jim, second by Jay. Any discussion? All in favor, say aye.
Aye.
Opposed? Carried. Okay. On to staffing.
So we have a few straight backfill requests. The first one's for county attorney, the deputy county attorney vacating on August 27th due to a resignation. For the district attorney, we have two assistant district attorneys leaving, actually left in July due to resignations. Public defender, we had an assistant public defender resign on July 25th. And for veterans, we had a motor vehicle operator part-time resign in May, actually due to resignation.
Ryan is, I guess I asked Dean too, is all these attorney resignations related to salary as we had the discussion at the safety meeting?
I know the assistant public defender, he had been planning for a while. His significant other, I believe, was graduating med school down south, so that's been known for a while. My office, it's partially salary, partially he's gonna be moving back to where his family's from, friends and whatnot. As for the assistant district attorneys, my understanding is I believe one bought a house in Vermont, got a job with the Vermont State's Attorney's Office. And the other, I believe, took a private practice position where she could work remotely from home. That's my understanding of. I can't speak certainly for Tony's offices. That's what I've been told. The other two I have really decent amount of knowledge of.
Good. I was hoping you were gonna come back and say, yes, it is, and then we could go deeper into the.
Well, is
discussion.
it a part of it? I mean, certainly for my office is a part of it, yes.
Okay.
Yeah, I think the one, they bought a house in Fairhaven, I believe,
Right.
and she really wanted to stay, but she couldn't be left downstate.
I think the bigger discussion is that the attorneys are certainly a problem, as are all positions probably here. But I don't know that anyone realizes the trajectory we're on, that we're in the most dire fiscal crisis we've ever been in any time I've been here. This is way worse than what I came into. We're looking at a possible on-cash basis of $2 million available in February. The trajectory we're on, with a payroll of 3 million a month. So I don't think that's a good, so I would think you can't do it with attorneys, because if you get rid of attorneys, it costs us more money, but at some point, we're probably looking at a higher increase. And at some point, we're probably looking at trying to cut through attrition or however we have to, we're gonna have to contract the size of county government to not just blow up the county taxpayers. And that'll cause more homelessness because they won't be able to pay the taxes, it'll be more in the foreclosures auction. I mean, I can't be any more straightforward and fair with you of what we actually see. This is as bad as it gets.
I understand that, Brian, but, you know, again, as Al was proposing and with the grant money, we were spending an extra 80 or 100,000 to save 200,000 or 300,000.
Yes,
You know,
that point's well taken, and if we could cut 2 or 3 million in salary, and because you're gonna have to give raises for $1 million, that might make sense too. I don't know what we can do. The request will probably put us above 30% is my guess on what you'd need to fund everything they're gonna ask for, and it may be higher than that. We've been at 40 before on requests. It's never been real, but right now there's lots of places you can't cut. And there's places you can, as Bob said, you have to decide what programs you are not going to do. And it's tough for me to just go and cut highway in the sheriff department when they aren't the problem. They aren't the ones that put us in that position, but that doesn't mean there won't have to be some drawback across the board. There may be. Just so you know.
So I agree, Brian, that we're gonna have to be hard to look at the budget. And it's gonna extend over not just the next 6 months, 5 months to get 4 months, lunchtime, or, yeah, 4 months. It's gonna extend over next period of time too,
Oh, yeah.
next year. But I think that we have to be extremely careful what we're looking at, how we're looking at it. And while I agree with the hiring freeze, there's some positions we can't live without because we have.
Absolutely. No, it's gonna be a scalpel, not a broadsword.
Yeah, so I think we look at it, I think we need to evaluate every program in the county.
Yep.
And maybe you have to look at how we deliver services also.
Or don't deliver services.
That has to do with delivering. Yes or no? One way or another.
Charlie?
So this problem covers a lot of areas, and I'm wondering if we're trying to address part of it here, but this is a personnel meeting, we can't address it in finance. Do we need to put together a working group or committee to actually work on this?
It really needs to be the whole board.
Well,
Everybody really needs to take part, and that's the problem. We haven't in the past. And you can have a working committee and you still have a couple people taking part. It really needs to be all 17.
It will never be more important than this year to have the board engaged in the budgets. So one of the things I give Brian a great amount of credit is he holds budget workshops while he's developing his budget. Normally, what happens in those budget workshops is there's crickets in the room and they just have Brian present the best budget he thinks he can. My respectful request to the board this year would please be engaged and active in the budget workshops. Even if you think something is unpopular or something you think is completely harebrained. If I've ever learned anything at all, if you continue to do what you've always done, you'll get what you've always got. So please, if you have something outside the box, there's never gonna be a more important year than this year. And to your point, we are gonna touch on some of this at finance, Supervisor.
With all due respect, that sounds great. However, as I've said before, I think the department heads are the ones that have to take a hard look at things. And they have to be told not only that we're in this dire position, but perhaps given something like we need to cut 5 or 10%. Give us a 5% cut, give us a 10% cut, and see what it is. And then the supervisors look at it and talk with them. They're the boots on the ground. They're the ones that know where they can do it. We have 17 people here and somebody presents a budget. We're all going to 17 of us look at it and say, well, gee, why don't you cut here? Why don't you cut there? I mean, in some cases, people are close enough, chairs, the people on the committee, to do a little bit of that. But I think the department heads really have to come forward, and it's gonna be hard. And it's not gonna be the answer. It's not gonna come forward and all the ones are 10%, we say, oh gee, everything's cool now, but it's a start. And I think that's what we gotta start
And we've
with
given
them.
them that opportunity probably every year I've done the budget.
I don't-
And
I'm not
every
saying
year
not
they
to
give
do
us
it,
an
I'm saying,
increase. Even when I ask for a decrease, they give me an increase.
well, that has to change.
Well, it has to change, but it's the same department heads year after year after year. So I don't know, unless they're new people, I don't know how you get them to change.
So can I ask a question? How do you expect a department head, any department, to keep decreasing costs when the cost of everything is increasing? I don't know how we can put that on all department heads. When the costs of everything are going up, they're fringe, they have no control of that. The wages, they have no control of that. Any of the conferences they go to, those have increased. Education, that's all increased. So I don't know how you expect, I'm just asking, I don't know how you expect them to keep decreasing their budgets when not everybody has that fluff that we're talking about. They were told years ago to cut that fluff. So I don't know how we're supposed to come up with that.
And
Are
that's
there
why I,
operations in departments that are not as absolutely needed?
yes.
And that's where I think those workshops come in and those questions come in. Where they're gonna be longer, I think, this year, those workshops. Sometimes it's because they get so tedious, they get long and we're trying to get through them. But I think, like Al mentioned, we've gotta spend the time this year and really ask the questions during those workshops.
I just gotta say just one more time, is in my experience of doing this in other venues, is you want the people that are in charge of the department
Absolutely.
taking a look at that and coming back with something, because I'd rather them say, if we gotta do it, this is where I'd like to do it. Rather than us looking at it and saying, well, we want you to do this.
And I've given them that opportunity every year, and when we actually have had to cut, I've gone back to them a second and third time and say, listen, you're not gonna like it if we cut it, because we're gonna cut something that shouldn't, so give us what can be cut. But at this point, we need to look at everything that is not mandated, or things that we actually don't wanna do as a county, and get those out of there first. The problem is the things you can cut are the things you actually want for your county. And that's a problem, but that's what we're gonna be up against.
So two things. First of all, I think when you look at their budgets, you should take salary and fringe out of that because they don't have much control over them. If they're cutting people, if there are programs cut, they'll have direct effect on salaries and
Yes.
fringe. And healthcare and salaries are the biggest thing right now.
You guys are gonna see some numbers at finance, if you wanna move this conversation to finance. You're gonna see some of this in the very near future.
But just to follow the thought, the second is should you, when you go to your, think about when you go to the departments on your visits to talk to them, should you include include the committee chair? That help? Get more information, so the committee chair can come in and say, yeah, we sat and listened to talk to them, and here's what we talked about.
And we can move to finance. I've talked to Deb last year about this, and we talked about it already this year. Is she'll come to the table with a list of things that she's not gonna be able to do. It's,
The way it works.
and this is the cost of each project, and so you can defer. But
It's still gonna be done at some point.
at some point, they gotta be.
But deferment is, cost us big time.
Yep.
That time we deferred, it took us, what, 10 years to get back to where we should be? And we still weren't where we should be.
I'll save my comments on all that for the
Yeah.
next meeting, but
Yeah.
that's, because that's not as dire as it was in the past, but.
Right, so perhaps this is most appropriate in personnel. We're talking about nothing but cutting, but we also have probably opportunities now that we didn't have 5 years ago or 3 years ago to improve productivity.
Yes.
So the improvements that we could see in productivity, which require training and thought in what technologies are available today, actually would be an incentive in a lot of ways for the management teams to come on board with that. And productivity gains of 20 or 30%, especially in the very clerical driven, is very, very feasible, very feasible.
And I'm not trying to be braggadocious, but when I took over as treasurer, we had 13 full-time employees in my department. I now have 6 full-time and 2 part-time. Again, I'm not being braggadocious, but I'm saying you can review your operation, and hopefully we are. Hopefully we are. You know, because of my position, I try to lead by example, so I've taken hard looks. And some of them are painful. You know, there are times a year that my staff, there's not amount of Snickers in the world that's gonna get them through the day, because, you know, we also took on collecting for a town, collecting for 3 schools. You know, so we're still trying to do more with less. So I think some department heads are already trying to reinvent themselves. And I think that we can do better. I think that we do try annually to see what we can do better. At least I hope we all.
No, I know, all the past keys were stored in your office, it was so you could give things out when you couldn't pay them.
Braggadocious, he's taking Bob's new words. I wanna look that one up.
So, and that's a prime example of why 5% to every department doesn't work, because here's you got a department that's cut from 13 to 9, how do you make, so if you're frugal, you pay the price, if you have fluff, it really didn't even harm you. That's kind of the way the situation.
And you have to think about the succession plan there also. So you've cut, but eventually that's gonna cost you when you have vacancies of positions that are higher up, whether it's a department head or the person directly under that, and you have no one to put in that position. Next thing you know, we're raising the salary up to try to get someone to take it. So there's,
Yeah.
Except for your electeds.
All of us?
All of it.
All I know is you're gonna get you're gonna get elected twice in the next year. Each town gets that opportunity, so turnover is probably gonna be huge after this budget. Very good. So we're all set with that. We're on to the staffing pattern, that'll be great.
So we had an item moved from public safety. It was asked for a staffing pattern addition and a title by grade addition. They requested 6 per diem positions under the title of emergency medical provider. It is grant funded up until March of 2026. It would add 3 titles to the title by grade. Emergency medical provider, EMT, would be the first one at a grade 11. And emergency medical provider, advanced EMT, at a grade 12. And then emergency medical provider medic at a grade 14. That's-
And they assume that may keep coming, but they don't really know, right? The funding.
Yes,
I will second it, but I'd like to have it for position sunset on the 31st of March unless we find other funding.
Yeah, I think that's kind of where we're gonna be at, because I don't have a way to fund that.
can bring it back.
Discussion.
They do.
Just out of curiosity, could any of that be, funded a little bit from the opioid?
Possible. But that's the good thing is it would come up in March and we could move money from there if there's money there and take care of it.
Okay, qualify, that would be a
That'd be a stretch.
that would be a stretch,
That'd be a stretch.
I don't know if it'd be a huge stretch. Most of their calls are for opioids. I don't know if that is a stretch.
But prevention and abatement are their top priorities with them, so we just have to be careful.
Yeah, we could have these folks getting out of convention flyers.
That's creative.
We could use the Narcan pens and it sticks on the leg. The flyer.
Brian. It won't, not for today. Okay, not for today, but at some point, I would like this committee, and I've told Danielle this already. This is another great example. So we have a situation in public health where we have an either or on the staffing pattern. This is gonna be an either or, right? He can choose from 3 options on this. With our staffing pattern, and now we've gone to a thing called position budgeting in New World, which will be helpful to the personnel officer, the budget officer. So we now have a 1-to-1 relationship. So you can only be on payroll now if your position exists in our staffing pattern. There's literally a 1-to-1 relationship. I think at some point it would behoove us to have a conversation about ones like public health where she can hire either X or Y, where Tim can hire either X, Y, or Z. And even if you wanted to have the conversation, when you start in an office like mine, right, there's a promotional track, right? When you come new to me, even though I was authorized to have a bookkeeper, I have to hire an account clerk, who then becomes a senior account clerk, who then becomes a bookkeeper. So there's a promotional track to the position that I was already approved for. But in our current world, every time I hire a new employee, I have to go to the board, get an act of God to change the staffing pattern, and then for the second track, same thing. Third, so even though you all have told me I can have a bookkeeper, each time that person goes a step in the pattern, I have to come back to the board. So I'd love at some point to have a conversation about these either or departments. And equally as important, some of the promotional tracks. Because if the board was willing to say, Al is approved up to a bookkeeper, Danielle could manage that, like she does the backfill requests without formal board action. If you know that, Al's gonna hire an account clerk, but he's authorized up to a bookkeeper, and Danielle will manage when they're civil service eligible to promote to the next step.
So the downside of that, because we never see eye to eye.
We've
on
never
this.
seen eye to eye on this.
Probably won't ever, but, because the downside of that is you're always budgeting then for the bookkeeper, and not every position ever goes up to the bookkeeper. So
But it
you're
would-
gonna be budgeting for that higher position, even though you may never have more than an account clerk.
But
Just because you've always had one, doesn't mean You will in the future.
No, with position budgeting, will be budgeted for the person in the seat, not
Right.
for what we're
So you
approving.
wouldn't have to budget.
So
for
that,
the
that
bookkeeper.
concern is actually alleviated by position budgeting.
So how do you all of a sudden have money for a bookkeeper if you've only budgeted for an account clerk?
So I would be planning with Danielle when that promotion was gonna happen. And if I knew it was gonna be in July, it's something that you add into the position budgeting. It would budget for the senior account clerk. And then there would be additional money done in July as a budget amendment for the most.
So isn't that what everyone's been complaining about for the last 10 years, not adding money mid-year? Or
But that's what, I think that's what he just said, was you would only budget for it when you were gonna do it, other words, it
Right.
wouldn't get
But I
added.
thought we
It
didn't
wouldn't
even
get
want to
added until the
entertain
new
it.
budget. It would only get done on budget.
So question. In your scenario, you have to accept a conflict with senior accountant to bookkeeper.
Yes, sir.
Well, what if you had someone allow transfer, want to go from bookkeeper to bookkeeper?
So then
How
I
do you
wouldn't
manage
need
that?
board action and I would be budgeting. So I'm never gonna budget for more than what I know is gonna be in the seat. That's not fiscally responsible. I'm not gonna budget for a bookkeeper when I know there's an account clerk. And the beautiful thing about position budgeting, it won't let me. If that person in that seat right now holds the title account clerk, the system is going to budget as an account clerk. So we've already prevented some of that over budgeting just by switching to the new software. Just by utilizing position budgeting, we've already taken out any of the human error that could happen in that scenario.
But what happens if you found a bookkeeper that was extremely good at the job and wanted to leave, the department out there and come to your department? Because such a great leadership there.
And then I would have to come back to the board to talk about the money, but the position would already be authorized.
Well, there's another way to do that. You could also make the position stay open for the length of time it would take to get the extra money. And it might already be open that length.
And again, I didn't want to tie today's meeting up, but I do want to plant the seed that there's some inefficiencies that we have built into our system.
And we've done that before. We've actually made vacancies stay open 60 days to prove that you actually needed them.
You've already given Danielle the
Done that
ability to
before.
work on backfills, right? That's a fairly new thing.
Right.
And look at how amazingly efficient that is. I would argue that that's a great personnel decision that you all have made. Giving Danielle the ability to deal with the backfills is amazing for the operation.
But that is allowed the exact opposite of what Brian just said.
What I
about
just
where-
said.
Where you used to
You-
make them wait
right, you
30
may
to
have
60
to-
days.
And we may be in the position where we have to make
And
them
that's a-
wait
And
to
that's a
prove
fiscal
they.
decision.
Right, that's a fiscal decision at that point. That's,
Again, I just wanted to plant the seed. I apologize for squirrel.
I mean, there's a way to tighten the belt here, and I mean, nobody's gonna be happy about it. I can agree with that.
So
Seen that before.
That would be great.
we have to vote on the motion.
I am one of those that, if you're budgeted for this position in January, do not come in March.
Right,
And I'm one of those that are against that.
Yep.
And I'll still stay against that.
And I think you would know at budget time. If I had a planned promotion in July, you would know that at budget time. It wouldn't be during the year.
That would be okay, if we knew at budget time,
Shame on me if I can't plan my organization.
bingo.
We've seen, isn't it the exempt schedule or the non-exempt schedule? There's one that we authorize and you see on that sometimes. Where in mid-year, they're changing in their salary.
So
So
that's
it's
step-
possible to,
steps
we've
along-
all seen it.
Steps in
Right.
longevity happen January and July.
Right, so we've seen that schedule where it can happen before. You never noticed it before. Some of them do change in July.
And we budget
It
for
is
those accordingly.
okay, so this is a motion and a second with a sunset date, unless there's funding, but that would come back to us on that. All in favor, say aye.
Aye.
Opposed? Carried.
There was another item that was moved from Health and Human Services. Gina brought a position request of a nutrition services specialist part-time to be added to the staffing pattern and the title by grade at a grade 16. This is a position, she went out for RFP for a registered dietitian, didn't receive any responses. She feels this position may help with that, hopefully, if she can get that position filled. So, and I think she went into it more and helped.
She went into more detail that she's able to use the group right now. And as long as we're trying to fill it, she can keep using that group. So as long as she keeps bringing it to the board, we can keep passing it, declining it, whatever we do, as long as she's still making an effort. She can keep using that group.
This would be her effort.
This is her effort.
Yeah,
And is that group something we pay for, the state's paying for?
it's not paid for.
Right, so it's, maybe we want to lower the grade. Make it less likely for someone to come in, we don't have to pay for it.
I don't know that that would be necessarily pursuing the position at that point.
Yeah, I think there's certain calls that they have to have.
And a question that I've asked, and I don't think I've got an answer to yet, and maybe I didn't listen. I'm shocked that we don't have a resource in the county, whether it's public health or one of the local schools, that we could contract with. I find it very surprising.
And she's tried that route.
For the amount of people who need a nutritionist, that there isn't somebody willing to.
So BOCES like handles the nutrition and I have a direct contact with the guy that was in charge of that. So I talked to him and he said it's just, they're lacking the amount of people in that area. They're just not available. And I talked to Andy Cruikshank at Fort Hudson. And he had a guy retire, he thought might be willing to work part-time, but they're just stretched, they're all just stretched too far.
Oh my God, Gina said it was like 4 hours a week. It didn't seem like it was a large group.
And that's what the problem is. It's not enough to hire somebody full-time. But you're adding 4 hours to somebody that's already putting in 40 hours or more. And so they don't want
But I'm
it.
surprised that like the Fort Hudson nursing home,
I think
Doesn't
Jenny
have-
did reach out to the.
the ability.
I know she did,
She's
yeah.
right there, she's trying public
That
health.
one just made the most sense because they're right there, you know, could they review them?
Even the schools need a dietitian.
Yeah, but they do it through BOCES, so it's a bigger, and
It's just unfortunate there isn't a local resource.
And what she talked about was the state may be hiring the actual dietitian, so the nutritionist at our level could do the work. And that's in the big picture, almost like, well, I compared it to the health centers, having one physician and physician assistants and nurse practitioners, same idea.
What does this position do in 4 hours a week? I mean, do they meet with groups, meet with people?
16 hours.
Oh, yeah, right.
They-
So what do they,
They have to certify the
schedule.
menu.
They have to
mid-sentence.
certify.
Certify the
so this
menu.
is something that actually has to be done?
Yes, it has to be done at the jail and at OFA, and they both use the same group. So it's not like something you can't actually solve.
Open to,
The good news is
Use the
they've
same-
like approved menus they're using. So like, but if something runs short and you have to replace it with some, that's a problem. You have to recalculate the menu.
But to Jay's point and your point, why don't we just have a complete set of menus for the next 3 years?
If we do,
And then we don't need this person.
So
They're all
they
approved.
require
you're required to look at it periodically, and plus the fact sometimes some of the foods that are on the menu aren't available. So to make a switch,
That's like the menus we have already built in.
Yeah. and so that's why we're getting along so well right at the moment.
It sounds like there's no other questions. Okay, still, so can we put it off for another month to get the answers to the questions?
We can, because voting it down accomplishes the same thing as passing it. That's the truth of the matter. But I think she answered everything in the meeting. I don't know if she wants to go through that again, but I'll leave that up to the
this
board.
is a required position,
Yeah,
whether we get farming out,
right.
which I think she's hoping to do by going through this process.
So where are we at here? Did we get a motion?
Get a motion, yeah, and move it.
Second,
All in favor, say aye.
I,
Opposed?
Nay.
Carried. Okay. Input change is on the back of your sheet. If you
So
remember.
we were asked to, add emergency medical technician to the, handbook, and while reviewing a little bit more.
Yep.
I went in to add a little more clear lines as to responding to emergencies while on duty and then prior to the start of work. So kind of broke that down, and then the approval and disapproval by the department head or immediate supervisor. And then the documentation needed. So it's a little bit more clear, I think, in this format.
I agree. I'll make a motion.
Move by Daryl, second.
I'll second it. I did have a
Kim,
comment.
Dave. All in favor, say aye. Hold on.
No question.
Good question.
So in here you say volunteer departments received.
Where's
Some
that?
of our EMTs on
right.
the procedure. Third line down, it says volunteer department referencing EMS. Maybe nitpicking, but some of them aren't really volunteer.
But they wouldn't be working for us if they're
But
not.
the volunteers responding while the actual EMT
Working person,
Right.
like a
is
paid,
employed by.
if they're, I guess if they're called, it would then be their call, right? Is that how it works? If
What's
they're,
your question, Dave? If somebody-
Yeah, I don't think it
I guess
affects,
it's-
I don't think it affects our employees. That's the point. This is about our employees, I believe.
Correct.
So that wouldn't affect our employees. So that's kind of a non-issue.
Yeah, the rewrite was to include emergency
EMT.
medical,
Yes.
EMTs, not just fire, but just to include
Right.
EMTs.
Anybody
The
that
process of
volunteered might-
reviewing it, she reorganized the
Yep.
paragraph.
It doesn't relate to people that work outside here.
Yeah, second job.
They could, but they're probably not here if they do. All in favor, say aye.
Aye.
Opposed? Okay. All else I think we have is
the last
executive
thing,
session.
well, we have, the wellness fair, it's
Oh,
August
fair
12th.
listener.
You are all around and make an appearance at the wellness fair. 10:30 to 11:30, well, for all of our employees, it's in the training rooms in the basement.
Okay. Motion to go into executive session and the attorney will tell us why.
To discuss the appointment of a particular person.
Second.
Kim, second by Darrell, all in favor, say aye.
Aye.